wash my hands, and it's important so that each patient knows that you're clean and that you're not spreading germs from another patient to a new patient. Hi, Ms. Falco. I'm Katerina, and I'll be your nurse today conducting your health assessment.
Okay.
If you have any questions, just let me know. This should only take about 20 minutes or so.
Okay. You can call me Angela.
Okay, Miss Angela. Everything you say will be kept confidential.
Okay.
So first I'm going to start. What is your full name?
Angela Renee Falco.
Okay, what's today's date?
October 1st, 2019.
Okay. Can you tell me where we're at right now?
My house.
Alright. And she is alert, oriented, ×4. Her facial expressions are appropriate. She is making eye contact. How do you feel today?
Feel good.
Okay, her mood is good, her affect is appropriate, her attention span is, she's able to answer questions and hold a conversation with me. And then I'm just going to assess your recent and remote memory. So I'm going to ask you to remember 4 words, and then I'm going to occasionally ask you to repeat those.
Okay.
So the 4 words are dog, circle, house, and banana.
Okay.
So I took her vitals before we got started. Her blood pressure is 110/70. Her pulse was, or her respirations were 20. Her heart rate was 72. Pulse ox 98%. Her temperature was 97.8 orally, all within normal limits. Are you in any pain today?
No.
Can you repeat those 4 words for me?
Yes. Dog, house, circle, and banana.
Okay. Alright, and we are going to start on the head. The head is monocephalic. Hair is evenly dispersed, free from lesions. Hair is fine, dry, not super oily. No parasites as well on her hair. Her face is symmetrical. Her eyes are on the upper third of her face. Her nose is midline, and her mouth is on the bottom third of her face. I'm gonna test cranial nerve number 5. So you just close your eyes, and I'm gonna touch you with a cotton ball, and you tell me what part of your face I'm touching.
Forehead. Right cheek. Chin. Left cheek.
Okay. And if you will clench your jaw for me real tight. So it's strong bilaterally. And also cranial nerve number 7. If you take your glasses off for me. So there's no eye droopings, or her face is symmetrical. And you just close your eyes for me, and I'm going to try and pull up. Alright. And so cranial nerve number 7 is intact. Okay, and now I'm going to check your nails. Just let me look. So no fingernail polish. Her nails are convex, trim, translucent. Craft refills is less than 3 seconds. The angle between the nail bed is less than 160. No clubbing. I'm going to check your toes as well. And her calf refills in her toes is less than 3 seconds as well. So Miss Angela, can you repeat those 4 words for me?
Dog, house, circle, banana.
Okay, awesome, thank you. Now we're going to move on to your eyes. So eye is free of discharge, lesions. Her eyelashes are everted, evenly distributed bilaterally, and top and bottom. Her eyebrows are present, symmetrical. They're coarse. They're brown. No scaliness. No lesions. And at this time, I would check cranial nerve number 2, which is the optic nerve, and we would use the Snellen eye chart, and she will stand 20 feet away use the 3x5 card, check one at a time, and then check the next one. And she does wear glasses, so we would check with glasses and without glasses. To check for color discrimination, we use the Ishihara charts, which are the little circles with the different colors in them. And so she would be able to tell us if she can distinguish between, thank you, distinguish between different colors. Okay, now I'm gonna check cranial nerves 3, 4, and 6, which is the ocular, trochlear, and abducens. So if you will just follow my pen light. So her extraocular movements are intact. There's no nystagmus. And at this time, I'm going to check her pupils. And her pupils are black. They're about a 4 millimeter. We're going to check and see if they react to light. Okay. Okay. So they both react to light. And she also has the consensual reflex. So now I'm going to have you look at my finger, and I'm going to tell you you're going to look off in the distance, okay? Look off in the distance. Okay, and her accommodation is intact, so her eyes are pupil, equal, round, reactive to light, and accommodating. And that is cranial nerve number 3. So if we were going to use the ophthalmoscope, we're coming with a 20-degree angle and check the eye reflex, the red eye reflex, which would be normal. Okay, so now I'm going to move on to the ears. So her ears are symmetrical. The tip of the ear is at the palpable fissure. Her color is same as those of her face. She has a piercing in each ear. There's no drainage. So just let me know if you feel any tenderness. No tenderness? No tenderness over the auricle, the tragus, or the mastoid process. I'm going to use my pen light and look for any drainage. For your drainage. No drainage. Your ears are elastic, have medial recoil. And then we are going to check cranial nerve number 6. So if you just close one ear, and I'm gonna say a 2-syllable word. Chocolate.
Chocolate.
Okay. Close this one. Popsicle.
Popsicle.
Okay. So cranial nerve number 6 is intact.
Those were more than 2 syllables.
Those were more syllables. So if I was using an otoscope, we would look in the ear, and you could see all 3 bones of the ear and the tympanic membrane. So we're moving on to the nose. It's midline, no deviation. I'm going to palpate your sinuses, so you just tell me if you have any tenderness. No tenderness on the frontal or the maxillary sinuses. And I'm going to check cranial nerve number 1. So close your eyes, and then I'm going to have you plug one or hold one nostril, and you just going to smell this and tell me what you're smelling.
I smell lavender.
Okay. And then switch to the next one.
Vanilla.
Okay, so that's it on the nose, and we're going to move to the mouth. and put on some gloves for this one. Her lips are symmetrical. They are pink, moist, no cracking, no lesions. Get my pen light. Don't have a tongue depressor, but we're gonna. So I'm gonna test cranial nerve number 9 and 10. So I'm gonna push down and press ah. Her uvula is midline. Her teeth are all present. Her gingiva are pink. There's no edema, no retractions, no bleeding, no lesions. Her hard palate and soft palate are continuous and smooth. The hard palate is white with transverse rugae, and the soft palate is pink and smooth. I'm gonna check your tonsils. She does have tonsils. They're pink, no swelling. They're about a 1+. The dorsal surface of her tongue is pink, moist, and rough with the papillae. And so it is shiny and smooth, and you can see veins. Saliva is present and adequate. And cranial nerve number 12, stick out your tongue for me. Her tongue is midline. Okay, so that's all on the tongue. Take these gloves off. So on to the neck. The skin is the same color as the rest of her face. No lesions. It's symmetrical. No lesions. Move your neck side to side for me, and then front to back, and then around in a circle. Okay, and she has a full range of motions. Now I'm going to palpate for any crepitus. No palpable or audible crepitus. And then I'm going to test cranial nerve number 11, which is the accessory nerve. So I'm going to try and push down your shoulders, and then you just try and resist against me pushing. Okay? Okay, cranial nerve number 11 is intact. Her trapezius and sternocleidomastoid muscles are strong. Okay, and now I'm gonna palpate all your lymph nodes. You tell me if you have any tenderness. So I'm gonna start back here at occipital, and then preauricular, and then posterior auricular, tonsillar, submandibular, submental, superficial cervical, posterior cervical. And you turn your head to one side, and I'm going to palpate the deep cervical. I'm going to turn the other side. And then supraventricular. And I will check your carotid arteries one at a time. I'm going to turn. Facing, just kidding. Okay. So they're equal and strong bilaterally, and I will check for a bruit. So I'm going to listen, and you just hold your breath when I tell you to. Okay. 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 No bruit is heard, and a bruit could possibly indicate a narrowing of an artery. So then we're going to move on to the thorax and lungs. So her skin, the color is continuous. She has some scarring on her arms, free of lesions. I'm just gonna palpate on your back for any lumps. You have any pain back here? And you could turn it to the back. And I'm going to check for crepitus. And you just say 99.
99,
99.
99, 99.
And you can feel the vibrations, whatever she said, 99. And I'm going to check for chest expansion. So if you'll breathe in really deep for me. So it is symmetrical bilaterally. I'm going to take a listen. Okay. So she's got vesicular lung sounds in the peripheral lung field. So I'm going to check the lateral. You can turn this way. Okay. And check the lateral. Okay. Okay, and I'm going to also take anteriorly. So her lung sounds are clear. There's no adventitious sounds. I'm going to check your skin turgor. No tinting. Any percuss on your back view will turn around. So I'm going to tap my fingers and listen. So there's resonance, which is normal, with open lungs. Okay, turn back around for me. So for a breast exam, which we are not going to do, you would have the patient sit in 3 positions. So the first one, you would have them, their arms over their head, the hands on their hip, and leaning forward. And you would be looking for any increased vascularity, striae, lesions, dimpling of the skin. Areola should be darker in color. Nipples should be everted. No masses, no lumpus, no lumps, no edema. And you would also palpate the lymph nodes. You palpate the central and lateral, posterior, and anterior lymph nodes of the axillary. And you could palpate in the breast in 3 different ways. You could do the spokes of the wheel, which would go in and out. You could do vertical, which you would start with axilla and go down and up, or you can go in a circular motion. Then you would also squeeze nipples to see if there's any discharge. And then, can you remember those 4 words from earlier?
Doghouse, circle, banana.
Okay. so her recent and remote memory are intact. And I think that's it.
Okay.
Thank you for being a great patient.
You're welcome.